Here I am with MAURO FRADEANI from Pesaro, Italy, who's come to talk to the Florida Academy of Cosmetic Dentistry for our 2012 annual scientific session and trade show. I'm going to ask MAURO a few questions. Dr. FRADEANI, what have you seen has been the greatest change in our industry?
Oh, actually, I think the last decade at least, we had a lot of different, news from the industries, talking about techniques and materials, of course. Of course, I think the big development of the CAD/CAM technique is the major fact in the industry, and of course also for the people like us as dentists that have to work with. And of course also in the field of materials, especially ceramic material. As you know, the old ceramic restoration came out, the first one in '85, so many years ago. I was one of the starter, that I started to use like Dicor and Isoram, that probably you don't know, because they came out in '85. But then we had a lot of problems, breakage, etc., etc. But the concept was there, was very, very good. So I feel the last decade, two major families of the ceramic came out in the proper way. One is the high-strength ceramic, that one is the silica-based ceramics.
Now, Stefano, what is the main takeaway message, the most important point you would want our members to take away from today?
Hopefully, the fact that you cannot think only aesthetics. Aesthetics is the beginning, there is no question. So if you want to make an aesthetic or a cosmetic change to the teeth of your patient who comes in and maybe asks you to do that, it's all right. Go ahead and make that evaluation, but you have to take into consideration the implications from a function standpoint of what you're going to make as far as changes are concerned to those teeth. So for sure, I hope that at the end of this day, this message is going to be clear to everybody, and also how to do that.
How important is it today to provide hands-on leadership training to your team members?
I think it's critically important. I think in these days and times, top-down management styles just don't work as much anymore, and things are happening too fast, change is happening too fast. And so if we can get everybody on board to think strategically and to buy into the culture that a doctor is trying to live at their practice, and everyone makes consistent decisions, smart decisions, and acts as a leader at every level, those are the practices that will succeed and thrive. So I think it's critical.